and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video is a part of a series of videos on plantar fasciitis. If you'd like to see the entire series, go to bobandbrad.com and you'll find it there. Also, there is a printout that comes along with this particular video that you can have for your convenience.
Right. Watch the video and have it later on for checkoff. You don't have to keep coming back to...
Top 3 signs.
Then they don't have to look at us.
That's right. It's a lot easier. Top 3 signs you have plantar fasciitis. Number 1, there's going to be pain in the arch. Typically, and I've got kind of a fascia drawn here. Boy, my feet got dirty, but I've been walking around on it. So generally, the pain is quite often right here on the inner arch. Initially, when you injure the plantar fascia, which we think is some minor tears, a lot of times the whole arch hurts to start off with. I had a friend that just did this, and his whole arch was sore. I mean, no matter where I pushed on it. But eventually, it usually seems to kind of focus on that area where the main part of the stress is.
Usually on a patient, I will push. I'll start pushing around the area, and usually there's one spot that really is a trigger point. And that's where the tear is, but the pain can refer out, and it depends on how bad it is, but it's typical.
Right. Number 2, after sleeping overnight, generally the pain improves. It also improves when you're sitting. Like if you sit for quite a while, the pain goes away. But comes roaring back rapidly, sharp or intense after a few steps. That's kind of the telltale sign of plantar fasciitis. So if that's happening, pretty good sign you have plantar fasciitis.
Sure, you bet.
And generally, you know, after you've been up on it a while, a lot of times the pain somewhat diminishes.
Yep. Usually by the end of the day, people say, as a matter of fact, I've got a patient now, he's a carpenter, and it's painful in the morning. He says, by the end of the day, it's not so bad, but the next morning he gets out of bed.
And it starts all over again. Yep. All right, so we told you top 3 signs you have plantar fasciitis. How about top 3 signs your foot pain is not plantar fasciitis? 1, it's not tender over the arch. Let's say it's tender over the heel or the back of the heel. Then it's maybe more of a Achilles tendonitis or something, or a heel spur or something like that.
Sure, you bet.
2, it gets worse as you walk on it. So as the day goes on, it gets worse and worse. In that case, then it might be more of a bursitis.
Sure.
A heel spur, could be arthritis. As you get older, your fat pad here, there's a pad on your heel.
Yep.
It tends to thin out. And that can give you problems too, and it can make the heel very sore.
Right.
So all of it again goes back to the fact that it's not going to be sore in the arch; it's going to be sore more in the heel. And number 3, if it's tender over the sides of the heel, over here, and you can do what we call the squeeze test. Just squeeze right here, and if that hurts, that shouldn't hurt, and that could be a calcaneus fracture. That could be a fracture of that bone there.
Sure.
And you know, as you get older, sometimes it doesn't take much. Just land on that kind of hard. And if you're a little bit of osteoporosis, that actually could cause a fracture. So if that does hurt, you're going to want to monitor and have your doctor take a look at it.
Right. That's one of those things that you're going to have a scan or an X-ray or something. Could be a stress fracture. I don't know if
could be a stress fracture.
Stress fracture in the calcaneus.
Absolutely, absolutely, could be.
And that comes without even trauma, just from repetitive use.
That could be a runner. Could even get a stress fracture there. Okay. Again, watch the rest of the videos in the series to get the complete understanding of plantar fasciitis.
There you go. It's going to help, and we're going to need to get you back on your feet again.
Thanks for watching.